Member for Bateman.
Thank you, Madam Speaker. My question is to the Minister for Health. Minister, I refer to the rollout of the COVID-19 vaccination program and the efforts underway to get as many West Australians vaccinated as possible. And I ask, can the Minister update the House on the vaccination rollout, including vaccinations for students and school leavers? And can the Minister outline to the House what this government's decision to expand the vaccination mandate to primary and community health workers will mean for vulnerable people in our community?
The Minister for Health.
Madam Speaker, I thank the member for the question, and this government is extremely proud of West Australian community for stepping up and rolling up and getting themselves vaccinated. To date, Madam Speaker, we have 72.2% of West Australians have now had their first dose, and over 53% are fully vaccinated. So that puts us slightly ahead of Queensland, Madam Speaker, and slightly behind South Australia, but essentially level pegging with those states who are all managing their COVID-19 situations very well. And Madam Speaker, in addition to that, anyone wishing to attend West Australia's larger school leavers event in Dunsborough next month will need to be vaccinated. The Chief Health Officer, Madam Speaker, has provided advice to the government that this precaution is necessary to ensure a safe event for school leavers and the local community. One thing we can be sure of, Madam Speaker, is that at schoolies we can't be confident of physical distancing. And Madam Speaker, I think it's appropriate that we take these steps just to make sure that we continue to protect the community. Madam Speaker, we'll have pop-up clinics in Bunbury, Dunsborough and Busselton to make sure that these school leavers have every opportunity to get themselves vaccinated with at least one jab. And this will require all event attendees and personnel to be vaccinated with at least one dose by November the 22nd. Madam Speaker, also, subsequent to the latest health advice, workers in primary and community health services will be required to be fully vaccinated against COVID-19 to be able to attend their workplace. This is in addition, Madam Speaker, to the recent announcement around healthcare workers in public health hospitals, but this will now cover all primary health facilities such as GP clinics, allied health clinics, pharmacies, community health centres and so on. And this complements the the earlier announcements, which has received strong support and broad cross-section of peak bodies representing primary health and community health practitioners. Madam Speaker, the only way that what we have to do in our healthcare sector is make sure that we continue to protect the people who work in those clinics and the people that they look after. And the best way we can do that is to make sure that they're vaccinated. As transmission in primary health and community health setting could have major consequences for the community, including those at risk of severe disease associated with COVID-19. Health workers in community settings work closely with vulnerable groups, including the elderly and those with chronic disease or who are immunocompromised. And these vulnerable groups are at high risk of serious complications of COVID-19. So from the 1st of September, primary and community health workers will need to have at least their first dose of COVID-19 vaccine to access their workplace, bringing it into line with Tier 2 requirements in the current health worker restrictions and access directions and number 3. Madam Speaker, I'd like to thank all those in the healthcare sector, both the facility managers, but also in particular the health sector unions that have provided us with a great deal of support and facilitated an important conversation with their members to make sure that they understand the importance of getting vaccinated. Because, Madam Speaker, until we're all safe, none of us are safe. And I urge everyone to roll up for WA and get vaccinated.